Hi, nursing assessment tools. Nursing assessment is the first step in the nursing process, and it allows you to collect and analyze data that will guide your plan of care. Back home, in comparing nursing assessment back home and in this place, back home, you may get away with just doing the assessment and not charting it, at least not in details. But over here, you have to get used to doing your assessment as well as charting it. It is required both for patient safety and for your own good as you as the nurse, because all those things you document in the patient's chart are legal documents, so that if anything comes up in the future, those are the things that will, should I say, save you, or those are the things that will testify of what you did for the patient or what you did not do. So, in as much as the assessment and especially the charting itself is, it can be monotonous, it can be boring and time consuming, because charting your assessment and doing the assessment is one of the activities that will consume most of your time in a shift. So it may seem repetitive, but it is safer for you and the patient that it is done, because first, it helps you establish a baseline of how the patient was when you came on shift, so that if there are any changes as the shift progresses, you can tell that this is how this was and now this is how it is. And all that will guide your plan of care and what you should do for the nurse, for the patient as a nurse. So today I just want to focus on some assessment tools that you will come in contact with, which are not, you may not have encountered it in your nursing practice back home, or you may have encountered it in a superficial level or briefly. But in this setting here, over here, it is required. It's something that you must do. It is something that you must get used to. Luckily, the electronic health records have these tools built into them, so that you don't need to memorize the indices or the pointers. All you need to do is follow through on the electronic medical record. It's just like checking off a list. So you go through it one by one, assess all you need to assess, and then you document, rather than just having it in your memory, because if you do that, you will miss out some of the important points. So having established that, let me just go over a few of those assessment tools I'm referring to. Now, these tools are so many. There are so many of them. Some of them are screenings, some of them are scales, some of them are tools, or a combination of all of those three things I mentioned. But depending on your setting, some you will encounter some of them, you may not encounter some of them, but I'm just going to point out the most common ones, for the purpose of this video. So the first one is the pain scale. That one is very common. Every nurse ought to have encountered that one. And there are different types of pain scale. There's a pain scale that the patient can, if the patient can talk, the patient can report the scale. That's the numerical scale. That's the most common. On a scale of 1 to 10, what's your pain? So that one is common. There is the one that is, they use the smiley face. There's the one that is suited for children, suited for unconscious patients. So different types of pain scales you come across. And then there is the GCS, that's the Glasgow Coma Scale. So what it does is it assesses the level of consciousness of a patient. That's that one. Then there is RASS. That's Richmond Agitation and Sedation Scale. So just as the name implies, it is used to assess sedation and agitation. So the pointers will, once you go through all the list, it will tell you your patient is at this point, and then that information will now guide you as to what to do or not to do for the patient. Then there's the 4 scale, the 4 risk scale. There are different types of that one too. What that one does is that it tells you how much risk your patient is at to fall. So if the patient, the patient may be a low fall risk, a high fall risk, or a moderate fall risk. So that tells you what to do for the patient. If it's a high scale fall risk, there are certain things you should do for the patient. If it's low scale, there are certain things you should do for the patient, and all this should be documented. Then there is the Braden scale. The Braden scale helps to assess the risk for skin breakdown. So if your patient is maybe incontinent, the patient does not move himself on the bed, all those are factored into the scale to tell you how at risk your patient is to have skin breakdown. So that's what the Braden scale does. There are other versions of it too. It's not just that one that assesses skin breakdown. Then there is the CIWA, that's Clinical Institute Withdrawal Assessment. So what it does is to help you to assess and diagnose the severity of alcohol withdrawal in patients. So when you're able to put the patient in a certain category, you are able to treat, or you know exactly what to do for the patient. Then there is the CAM, that's Confusion Assessment Method. So what this one does is to identify delirium. If your patient has delirium, this scale helps you to point out if your patient has delirium, and then from there you know what to do for the patient. Then lastly, there is the Suicide Risk Assessment. Those ones too are different types. So essentially what it does is to help you identify if your patient is at risk for suicide. So again, once you are able to identify, then there is a line of action you are supposed to take for the patient. So that's what all these tools do. They tell you where your patient is at and what you should do for your patient, and they also help you to, when you implement the treatment, you still use these tools to tell you if your treatment is working or not. So I'm going to stop here. Thanks for listening. Make sure to like, share, subscribe, and follow for more.